with true cyclists, it's not just, you know, they're clipped in and they're pulling up as much as they're pushing down. So I see a lot of, not just the psoas hip flexor stuff with them, but a lot of TFL, tensor fasciae lata, and that usually is involved with really tight IT bands. And rarely I'll have a cyclist, and I see a number of them come in without a pretty tight IT band, TFL. I mean, you touch it and they're like, oh, you know, they feel great when you're done, but it's kind of torture to get through it. You know, definitely teaching them to get on a lacrosse ball or a foam roller and really get into these areas here. I know some people say lay on a ball to get the psoas. I'm not a big fan of having people do that. There's just a lot of stuff going on in there, and I feel like you should have kind of the skilled hands of weaving through the viscera to get down to that, and not just laying on a ball, you know, in the abdomen. But here, yeah, go for it. It's a lot of complex things there. If they have any kind of impingement at the hip, it's going to cause them on that side to kind of rotate and lift up, especially in arrow position. If they're riding up top, it's usually not an issue. But I'll have them bring in their trainer, you know, and bike, and I'll watch them, and, you know, first of all say, how symmetrical are we looking here? Are they lifting one hip versus the other? That's usually going to identify the issue. And if they feel that pinch there, or it can be a number of different tightnesses, weaknesses,